So let me tell you a little bit about my background. I'm a physician. I specialize in geriatric medicine, or sometimes called geriatrics. Geriatricians are specialists in caring for the needs of older adult patients. So these are particularly older adults that may be having chronic illnesses or health conditions, dealing with chronic illnesses, individuals that are on multiple medications, or those that have a lot of what we call geriatric syndromes, things that are related to aging and that are common in an aging population, such as frequent falls and memory problems and depression, urinary incontinence, osteoarthritis and vision and hearing problems. These types of syndromes add to the complexity of older patients that may have, on top of that, chronic health conditions such as cardiac disease and lung problems, and even longer-term illnesses like histories of cancer and those kinds of things. So I really consider myself as being sort of a specialist in the needs of older patients, particularly those that have complex illnesses. Oftentimes these patients that come to see a geriatrician are those that are having a significant change in their overall level of functioning. So things like their normal activities of daily living, bathing and dressing and taking care of those sorts of activities that many of us take for granted, that may be impacted by either physical illness or changes such as that occur in dementia that change the way people are thinking and their memory. So that's where I think that geriatricians can have the biggest impact, is when people are starting to have some of these changes that may require a consideration about what can be done to optimize their level of functioning. Does there need to be a transition to a different living environment for those individuals? And what can be done in terms of being prescribed multiple medications, taking a second look at that medication list and seeing if there's potentially areas that medications could be either contributing to some of the patient's problems, or that it could actually be causing some side effects and problems. A term that often we call is polypharmacy, being on many different medications. So that's really where I see the value of the geriatrician. Oftentimes, if we are involved in a patient's care early in the course, where maybe some subtle problems are occurring with the families are noticing that a particular person, a loved one, is not quite doing as well at home, paying bills and having problems with their memory or managing their medications. And if we can identify some of those problems early, we can oftentimes intervene with those types of patients and be able to either prevent further decline in their function, or try to make some changes to allow them to get back to their prior functional status. So I look at geriatrics as really being an emphasis on function, on quality of life, and on the complexity of these problems for aging patients. The downside to it is that there's not many of us across the country. There's not many geriatricians. We certainly need a greater workforce, particularly as our population across the country is growing older all the time. You can look at the demographics in any region of the country, and we are certainly a graying nation in terms of older patients. And oftentimes these older patients are those that are accessing the healthcare system, ending up in the hospital, seeing the primary care physicians most frequently. And I think these, particularly the most complex cases, the input of a geriatrician that has a specialized training in caring for these older adults can really have a significant impact on how these patients are doing, and again, the quality of life for these individuals.